Welcome to this special Network 18 conversation. Today, we are exploring the rapidly growing world of hair restoration and industry that's not just thriving in India, but also globally as well. Now, on one hand, new technologies are delivering amazing results, but on the other, the boom has also opened the door to unregulated clinics and unsafe practices. I'm your host, Sharon Elizabeth, and today I'm honored to have with us our visionary in the field of hair restoration, Dr. Prabdeep Sohi, who is the founder and chief hair transplant surgeon at the Reviva Clinic in Chandigarh. Dr. Sohi is internationally recognized for developing the Sohi FUE Punch, a revolutionary innovation that enables the extraction and transplantation of over 4,000 grafts in a single day. And with thousands of successful procedures and patients from across the world, his work has transformed both the science and the art of hair restoration. Now, Dr. Sohi, welcome to the show. Thank you for giving us your time. Now, first of all, let's talk about how, it in the beginning, in 2008 is when you opened your Reviva Clinic. What really inspired you to enter the field of hair restoration?
First of all, thank you very much for having me on this show. Back in 2008, when I passed out from plastic surgery and I started my practice, basically it was of a plastic surgery practice. And at that time, hair transplant in India was at its infancy, and uh, people often have to travel abroad to get good results. So there was a lot of demand back here in the home. So that was the thing which we decided to start doing hair transplant. And yes, it was a long learning curve. In next 2 or 3 years, we were able to give good results to the patient, and slowly it picked up.
And also, when we talk about your clinic, it has grown into a global name in FUE hair transplant. So, what are the core vision that drove you to come to this from the very start?
But as far as hair transplant is concerned, basically it's a mixture of science, technology, and artistry. Uh, Science, gives us safety of the procedure. The technology at that time, though it wasn't advanced, but it was still precise, and gradually it has improved uh, till date to give a very precise results. And then the third component was the artistry, an eye for the detail, which gives a good result, like natural hairline, natural angles of the hair to give a decent good results.
And you are credited with the pioneering method, which is Sohi FUE Punch. So, take us through, explain us in simple terms that what is really this procedure and what really it means.
There are various parts in hair transplant. The part one is extraction of the follicles, which is taking out the follicles from the back of the head. And now those follicles are then implanted into the bald area for the full procedure. Now, there were various methods of extracting the follicles. Back then, it was a strip surgery where one used to take the strip of the skin and then harvest follicle from that part of the skin to implant the follicles. It was an invasive procedure which leads to a long linear scar and painful sometimes. Then FUE came, and at that time FUE is a follicular extraction technique where follicles are extracted with a punch which goes within the skin, and then we take out the follicle. Punch is a small cylindrical instrument which is sharp, and it goes in the skin, and then we take out the follicles. And at that time, most of the punches available were manual punches. Manual in the sense that you have to hold those punches in your hand, and then, like a rotating motion, you have to insert it and then take out the follicles. It was very slow and tedious procedure, and at that time, I still remember that we were doing around 500 to 700 grafts in a day, and then we, devised a punch which was motorized. It was the same FUE punch, but with the help of a motorized engine, it rotates by itself,
Okay.
so, which gives us a faster result, more precise, faster results. And gradually, the size we decreases the size of the punch. We improve the components of the punch in terms of initially it was made of stainless steel, and then we start making that punch with the titanium. So gradually, it became a faster procedure, less recovery time, less scarring, and minimal donor area deformities.
Okay.
And we were able to do mega sessions. And mega session is, when we do more than 3,500 or 4,000 grafts in a day. And before that, we were doing 500 to 1,000 grafts in a day.
Now, when we talk about 4,000 grafts in a single day, that's a remarkable achievement. So, what are the techniques or the methods that has been adopted to make sure that this achievement is reached or achieved through safety?
Well, doing 4,000 grafts in a day is just not about the speed. It's about the systems. It's about the protocols which are being followed. Like, we started motorized punch, which increased the speed of the harvesting. Initially, we were doing 500 to 1,000 grafts in a day, and with this device, we were doing 4,000 graft harvesting in a day. Then, then comes the role of a big team. There's a lot of people doing the procedure. It's not a one man's procedure. So everyone is trained in their respective parts. There's a team which is doing harvesting, then there's a team which is doing incisions, and then there are implanters who are implanting the graft. And it's a repetitive process, and once the team does this process daily, gradually in a matter of few months, you become very trained to do the procedure of 4,000 plus grafts in a day.
Now, we all know hair restoration is as much about psychology and confidence as it is about medicine. So, how do you approach the patients when they come to you with low self esteem? How do you instill that confidence to go about this procedure?
Well, on examining these patients, we find that apart from the hair loss, they suffer from low self-image in their life, and which affects their career, oblique studies a lot. So a proper history and giving them proper hope, and addressing all their concerns, help them to alleviate the anxieties associated with the hair loss. And then, of course, we treat the hair loss part of the patient.
So, Dr. Sohi, can you share a story of a patient that stayed with you, which you think with your treatment had a life-changing impact?
Yeah, there are few patients, who are always in our mind because we have worked very hard on them. One such patient was a burn victim. She was a 12-year-old girl. She had scalp burns. Around 60% of her scalp was burnt, and when we saw her, only 40% of the scalp had hair, and rest of the scalp had grafting. And we planned hair transplant for her, but the remaining donor area was so less and it was so precious that we planned the procedure in stages rather than doing it in a single session. And the other reason was to stage the procedure was the quality of her burnt skin, which was not very optimal to take all the grafts in a single session. So we did 4 surgeries in her in a span of 6 years, 6 to 8 years basically, and we grafted her. Initially, we did a procedure of around 800 to 1,000 grafts. Next time we did 1,000 more, and eventually in 4 surgeries we were able to implant around 4,500 to 4,700 grafts. And later we did micropigmentation also. And by 18 we finished all the procedures, and she was very happy with the result. She is around 24 now and getting married this time.
All right.
And then there are a lot of cases also, but at the very beginning we saw a patient in our practice. When you're doing good work in hair transplant, you see a lot of repair hair transplants also. Now, repair procedures are those procedures who have got hair transplant done elsewhere, but hasn't got good results basically. So you repair them to give a better result. Now, those patients can be easy, if donor area is still preserved, and you are doing repair just to increase the density of the result. So it's an easy process that you do a procedure again. You take out follicles, you improve the hairline which has already been done, and you improve the density and etc. Now, the particular patient we are talking about is he got his hair transplant in 1980. Basically, it was a very old technique, obsolete technique. Like before the invention of FUE, there was a strip surgery. That strip surgery was giving good results. Apart from the fact that it led to a linear scar on the back. But before that, in 80s and 70s and 80s, the hair transplant technique was punch technique, which used a very very large punch of around 0.5 to 0.6 millimeter, or sometimes 1 centimeter in size, like this much big. So with that large punch, they used to take out the grafts basically, and then they implant them here. Uh, it leads to a pluggy appearance, or what we call as a doll's head appearance, like you see here of a doll. They grow on the bunches and spaces in between basically. And in that particular area, the donor area was exhausted in her previous sessions. So we planned again. We planned stage surgeries. We did 3 surgeries in him. First surgery, we take follicles from the scalp and we implant in between those plugs. We improved his hairline. Then his hairline was very low, and it was giving very artificial results. So we did a few sessions of laser hair removal from his forehead to improve his hairline. Then we did another surgery. We harvested follicles from his chest. We harvested follicles from his beard area to fill all the area.
All right.
Yeah.
Okay. And when we talk about the unsafe practices, it is of course increasing. We have been seeing in the news as well. Some of the unsafe practices have in fact led to the mortality of the patient. So how to avoid that? How to make sure how to make sure that such incident doesn't happen in the future when it comes to hair restoration?
See, in recent years, there's a lot of mushrooming of hair clinics in India. Uh, and apart from the specialties like plastic surgeons, or dermatologists with a surgical background, everyone has started doing hair transplants, including dental surgeons. They are doing hair transplants, including the surgical assistants or the technicians. They have started hair transplant. Hair transplants are being done in salons. Hair transplant is done anywhere. There is no regulation. There's no strict regulation, I would say, as far as the managing hair transplant clinics are concerned. So this has led to a lot of complications, a lot of hair transplant cripples, and 1 or 2 incident of mortalities in recent years.
Wow. So that's, of course, a very life-changing situation that you have done as far as this patient is concerned. But when we talk about Reviva Clinic, it is a well-known brand now, not just in India, but also abroad. So are you planning to expand? And also, is there any new services that our viewers should look out for?
Yes, definitely. We are planning to expand. Firstly, in terms of the number of the centers, we are planning to expand in Tier 1 metro cities. But as far as the medical facilities are concerned, the scaling of a business is easy, but maintaining the results becomes difficult. So we want to scale it very slowly. We don't want to overscale it, or that sometimes it lead to bad results or lower results basically.
And with evolving demands of minimally invasive and naturally looking solution, how do you see the industry of hair restoration changing in coming days?
See, we can divide these into 2 parts. One is that the things that are going to happen definitely going to happen in next 5 to 7 years, and then there are things which can happen or which might take some more time. The things which are going to definitely happen is the improvement of instrumentation, improvement of the punches, improvement in the holding medium. Holding medium are the solutions where we keep the grafts once we take out them before the implantation. Now that's important for the survival of the graft. So there will be improvement in the holding mediums. So all these things will improve the results, decrease the scarring, and giving a better, more natural results. Then there will be role of AI in hair transplant as far as imaging is concerned, as far as planning is concerned, and as far as a patient's future hair loss is concerned. Basically. So these things are going to happen. Then another aspect of this is regenerative science. Basically, apart from hair transplant, there are other modalities available to treat hair loss. Right now, certain medications are available like minoxidil and finasteride, and new medications will come. Definitely, they are under trial, which give better result, which will give better result than the present medications. And then regenerative medicines. Right now, we are doing PRPs, the platelet-rich plasma, growth factor concentrate. Now, these formulations will improve in subsequent years, giving better results.
Okay.
Exosome therapies, and what I believe that gradually the distinction between surgical and non-surgical treatment of hair loss will blur. The requirement for hair transplant will decrease once these treatments improve, and the number of grafts will decrease because with these treatments, the present strands will be better taken care of.
Okay.
So these things are definitely going to happen in next 5 to 7 years. Then there are certain more advances which are still in infancy, but which might happen maybe early or later future. And the most promising one is the hair cloning. We can grow multiple follicles from few 2 or 3 or 10 follicles, and then these follicles will be implanted, and it will decrease or reduce the need of harvesting process, and it will be particularly helpful in patients who has very limited donor area.
Okay.
This will, but this technique will take some time. Right now, it's very experimental, basically.
But as a surgeon, as an innovator, how do you find the balance between science, technology, and artistry in this field?
Plastic surgery and hair transplant is always a balance of science, technology, and artistry. Science is the foundation uh, for uh, for the safety of the process, for giving the results of the process. Then technology gives precision to the procedure. With improvement in technology, better instrumentation, the results have improved, the scarring has decreased, and the outcome has definitely become natural. But the most important part is the artistry, because you have to be have a good eye of detail to give results, for a better hairline, the natural angle of the hair, the direction of the hair. So artistry definitely is the most important part, but it's always a combination of all the three to give a better and prolonged results.
And looking ahead, what do you think? When you talk about Reviva Clinic, how do you see your personal legacy of your clinic? What are you hoping for as far as Reviva Clinic is concerned?
Well, we are hoping to continue the good work which we are doing, and we are ourselves also committed to do certain innovations in the designs of the punch, and we want to open another branch doing research in regenerative medicine for the hair loss, and we do want to be remembered as a team which not only give results for the hair transplant, but which affects self-esteem in a very good way.
Thank you so much, Dr. Sohi, for sharing your journey, innovation, and the vision that you have for Reviva Clinic.
Thank you so much for having me on this show.
And viewers, Reviva Clinic is, of course, one such clinic in Chandigarh that has set a remarkable benchmark as far as hair restoration is concerned worldwide. Now, this has been such an eye-opening conversation, from highlighting global best practices to warning us about the unsafe shortcuts. Your perspective really shows why making informed choices is so important. And to everyone watching and listening, if you are thinking about cosmetic or transplant procedures, remember this. The doctor's credentials, safety measures, and proper aftercare aren't just optional extras. They are the foundation. Always ask questions, do your research, and don't get swayed just by flashy ads or cheap offers. Thank you for tuning in. Until next time, take care, stay safe, and stay informed.